Hi and welcome to the Veterinary Hospital at Santa Barbara Zoo. My name is Julie Barnes and I'm the Vice President of Animal Care and Health, and I'm also a veterinarian here at the zoo. And so this is a place where I spend a lot of my time while I'm at the zoo at work. And so this is a veterinary hospital where we have our vet staff and our veterinary technicians located. So we take care of all the health needs of the animals in the zoo. So we look after everything from the insects all the way through to the giraffe. So lots of variety in our day. Most of our animals we will actually go and see out in the zoo in their habitats. Sometimes we have animals who need to come to the zoo for some special diagnostics or some special care. And today I'm just going to show you around the hospital. We don't actually really have many patients in the hospital at the moment. We do like to keep most of our animals in their home habitats. That's where they're most comfortable, so we like to do as much of their care as possible where they're comfortable. Occasionally we will hospitalise an animal, but we try to avoid that if possible to reduce the stress on the animal. So this is the main area of the hospital. This is where our desks are, and sometimes we do some examinations out in this space here. I'll actually first take you into our animal holding room. So this is where we will actually hospitalise any animals. They will actually be in some of these enclosures at various times. We also have multiple incubators as well. So these are for animals that need, small animals that need intensive care, or birds that have been hatched. This is an incubator, then an egg incubator that we can actually hatch eggs from. Those birds then go into the incubators until they're old enough to move out of the incubators. Right now we have a couple of toads who are actually hospitalised, and if you want to get a closer look at these, I will actually lift the lid off so that you can see these toads. These are two western toads who are in hospital for some care. This one's name is Blob, and he's in with some foot issues at the moment, so he's getting some daily care for that. I do have to say that these toads have a lot of character, and we really love spending time with them. And I'll also show you our other toad. His name is Francois, and when I can get this lid off, oops, there we go. And this is Francois. So these guys are very, very cool amphibians, very relaxed, and they're a lot of fun to have around. He has an eye condition that we're treating him with, and so he gets eye drops several times a day. So as I said, we work from all the little things all the way through to the really big things. Alright, so, and these are enclosures where we can actually, slightly bigger enclosures where we can house animals that are under treatment. We actually have a radiated tortoise in here at the moment. So this is one of our radiated tortoises. It's one of our male tortoises. He's feeling a little bit off at the moment, and so he's in here for some special care and some diagnostics to be done. He's had some x-rays and some blood work done, and he's just getting some treatment at the moment. These guys are also a lot of fun as well. Outside we have an animal holding area with a pool for some special animals. So any of our aquatic animals that require a pool, we actually have a pool space out here and a contained area where we can do their daily care as well. Recently we had some penguins in here, but they're all taken care of and they have moved back to the penguin colony. So now we'll move into the surgery, which is where a lot of the good stuff really happens. So animals like giraffe, really, really big. Do you think we bring them down to the hospital? No, we don't usually. Yeah, so giraffe too big, we can't fit them in the door. So big animals like that, or some of our dangerous animals like gorillas and big cats, we'll actually go look at them in their holding areas or in their exhibits. And we'll do most of their care down there. If an animal needs to be anaesthetised so that we can do some diagnostic work, generally we will do that in their holding spaces. Some of the smaller animals, a lot of our birds, a lot of our reptiles, and some of our smaller mammals will actually come to the hospital to have their diagnostic workups done. And so this is the room where that happens, and this is our surgery, our dedicated surgery area. So we have a lot of fun veterinary equipment in here that helps us to take care of our animals. We have x-ray equipment, we have digital x-ray equipment, and we can actually get images over there. We have endoscopy equipment, which is really helpful. We have anaesthetic monitoring equipment. which is this equipment we actually put on the animals when they're asleep, and it helps us to know that they're breathing correctly, what their blood pressure is doing, just like when people go to the hospital as well. We have several anesthetic machines, we have a dental machine, and yes, we do dentals on our animals. We don't do them on our birds because they don't have teeth. We do them on some reptiles, and we do them on most of our mammals as well, for the ones who actually come to the hospital. We have an ultrasound over here, so we can also do ultrasounding of animals. So a lot of the equipment that you would expect to see in a human hospital, we also have for our animals. Here's another patient that we have in at the moment, a tiny little fish down here. So this guy came to the hospital yesterday and he was floating, which is abnormal. He wasn't able to stay at the bottom, which is where he should be. So he's received some treatment over the last 24 hours and he's actually doing better, but he'll stay with us a couple more days until we're sure he's okay. We have lots of surgery equipment. So we have all our surgery packs. Again, when you watch TV shows about human hospitals, if they're doing any surgery, they'll pull out packs like these. These are sterilized packs that we use for sterile surgeries, and lots of sterile equipment in here as well. All our suture material, you know, when we do surgeries and we have to sew the animals up, we have suture material just like what they use in human medicine, and lots of extra equipment in there as well. So moving out into our main hospital area, so as I mentioned earlier on, this is sort of the main area where the veterinarians and the veterinary technicians actually work. We have several different scales throughout the hospital, weighing scales. It's really, really important for us to weigh our animals when we're working with them. Their body weight is one of the best indications that we have of how an animal is actually doing. They can't come and talk to us and tell us what's wrong with them, so we have to use other parameters to work out how they're actually doing. And I say that they don't talk to us, but sometimes they do talk to us in their own peculiar way and let us know that something's not quite right, but they don't use words like we use. So over here we have all our darting equipment in this cupboard. I actually won't open the cupboard up, but some of our animals don't appreciate us getting close to them. They're dangerous, particularly the big cats and the gorillas. There's a certain amount that they are trained to do, so our keepers do work with them and do behavioural training. Many of our big cats are trained to take hand injections when they need their vaccines, when they need to be anaesthetised to do an examination with them, and also to collect blood as well. Our gorillas are also trained for many procedures as well. For them awake, they voluntarily participate. They're not forced to do it, they choose to do it. But sometimes we have to go beyond those behaviours, and in order to do that, we actually need them asleep to make sure that they're safe and that we're safe when doing that. So we have to use darting equipment in that situation. So we have several types of dart guns that we actually use for those purposes. Of course, the animals don't like it when they see the dart guns, but it's fairly quick. And in here is our pharmacy. So a pharmacy in a veterinary hospital is very important, just like in a human hospital. This is where all the medication lives. So we have all sorts of medication. Medication for small animals, for large animals, a lot of human medications as well, for all the different variety of animals that we see. Here at the zoo we have close to around about 500 animals. So we've got a lot of animals that we're taking care of on a daily basis. We also have equipment for sterilising all our surgical equipment. So we have two different types of autoclaves here as well. And we have a lot of disinfectants that are needed in order to keep all our animal spaces and our hospital nice and clean. And we have more darting equipment in here as well. And then coming back out into the hospital, we have another really cool piece of equipment that I want to show you that we acquired just last year. So we're really fortunate because a lot of veterinary hospitals do not have this equipment so far, and this was donated from a local company who makes these machines. We have our very own portable CT machine, which is amazing. It really helps our diagnostic capabilities, which means the tools that we use to find out what's wrong with animals. So they actually go on this table, they move into the CT drum, and then we get these images. It takes x-rays slices through the animal, and then those can be reconstructed to form a 3D image for us. So that gives us a lot of great diagnostic capacity. And I'll just show you some images over here from a CT. So this was from a penguin that was taken. And as I'll zoom through this, you can see as I'm moving through the slices and the different parts of the body that I can look for any abnormalities. So that's really cool. One other component that's very important in a veterinary hospital is the laboratory area. So we have a small laboratory area over here. So we have equipment here, including a microscope, where we can actually look at samples from an animal. We can look at blood smears, we can look at feces to see if they have any parasites. We can look at all sorts of other samples that we've taken from the animals. So a lot of our samples go out to external laboratories, but sometimes we look at our own samples here as well, and that's very important. And we have the equipment needed to deal with the blood work safely. We have centrifuges and special protective equipment to deal with these samples. Again, a very important diagnostic tool for us. So that's pretty much shows you our hospital today. So glad you can join us on a hospital tour, and we look forward to seeing you at the zoo soon.